Like all major surgical procedures, bariatric surgery does come with its risks. As a patient goes through our program, we will make sure that they fully understand all of the potential complications associated with their procedure. It's important to remember that the type of risks and their severity depends on the type of weight loss procedure performed and the underlying health of the individual prior to surgery. Similarly, we want to note that none of the risks that will be mentioned are any more likely than the complications associated with other commonly performed general surgery procedures. To begin, we want to note the difference between a complication or a risk and a consequence. Complications are known risks of any given surgical procedure with a certain defined frequency, whereas consequences are known outcomes that will happen to most, if not all, patients to a certain degree, such as weight loss, excess skin after extreme weight loss, and changes in satiety. Since all bariatric procedures performed involve stapling and possibly rerouting the intestinal tract, the most serious risk of these procedures is a leak. Although this is uncommon, occurring in less than 1% of patients, it can still arise. Another risk that may occur no matter the type of bariatric procedure performed is deep venous thrombosis, which can occur and ultimately lead to a pulmonary embolism. A pulmonary embolism occurs when a blood clot breaks off and travels to the lung. This is rare, yet is the most common reason an individual might experience a serious complication after surgery. Other risks related to procedures are small risks of wound infections. Similarly, as with any surgery, there could be bleeding to a degree that a patient could require a blood transfusion or even a reoperation. Most bariatric procedures share in their complications and consequences, but there are a few that are unique to each procedure. One potential complication associated with the gastric bypass is the risk of developing ulcers in the portion of the intestine that is attached to the stomach. This is usually treated with medications, but in rare circumstances might require surgery. Ulcers can be caused by smoking or taking anti-inflammatory pain medications, yet they can also occur for no reason at all. Another complication as a result of a gastric bypass is a stricture. This occurs when the opening between the pouch and the small intestine narrows. A stricture could result in difficulty eating and is one of the more common reasons an individual might have nausea and vomiting after surgery. Rarely does a stricture require reoperation, but instead can usually be fixed by endoscopic dilation or stretching the opening with a scope that is placed through the mouth. A complication associated with the sleeve gastrectomy, and one of the reasons patients may want to have their sleeve converted to a bypass, aside from unsatisfactory weight loss of course, is the development of reflux. Most of the time, reflux can be treated with medications, although occasionally it could require surgery to address the issue, such as revision of the sleeve, repair of a possible hiatal hernia, or conversion to a gastric bypass. Patients who have the duodenal switch are at risk of developing any of the above-mentioned complications. Yet the more common consequences of the duodenal switch is excessive weight loss, changes in bowel movements, and bowel frequency, in addition to possible extreme nutritional deficiencies as a result of the malabsorptive nature of this operation. If any of these consequences become a problem, they can be addressed by reattaching the intestine further upstream to reduce the malabsorptive component of the operation. As we have mentioned, our utmost concern is your safety. Your initial appointments and medical evaluations are intended to make sure you have a safe operation and quick recovery. Bariatric surgery does come with its risks, like all surgical procedures, yet there is an even greater risk if you continue to live with the disease of obesity without seeking treatment.